Hi, my name is Teresa. I'm here to talk to you about the newly FDA-approved medication Zontivity. This medication is manufactured by the company Merrick Sharp. It is a protease activator receptor 1 antagonist, and it is an antiplatelet agent that is designed to decrease the tendency of platelets to clump into blood clots. This decrease in formation of blood clots has reduced heart attacks and strokes in high-risk patients. Who is a high-risk patient? This is someone who has had a history of heart attacks or has blockage in the arteries of the lower extremities, also known as peripheral artery disease. Zontivity is administered orally once a day with either aspirin or Plavix. No other antiplatelet medication has been studied with Zontivity, nor has Zontivity been tested by itself. The safety and effectiveness of this medication in the pediatric patient has not been established yet. Zontivity does come with counterindications, which include a history of stroke, TIA, or intracranial bleed. Because of the risk of hemorrhage in this population, Zontivity should not be given. Zontivity should be discontinued in any patient that does experience a stroke, a TIA, or intracranial hemorrhage. Another counterindication is pathological bleeding, such as a pulmonary ulcer. Warnings that should be made aware of while taking Zontivity include the risk for bleeding. People that are older in age, have a low body weight, have a reduced renal hepatic functions, or previous history of blood disorders or bleeding disorders should be monitored closely while taking Zontivity. Also, certain medications such as chronic use of NSAIDs or SSRIs should not be taken because of the increased risk of bleeding. Also, avoid using medications such as Coumadin and other anticoagulations while on Zontivity. There is no adequate and well-controlled studies on Zontivity and pregnant women, but if a pregnant woman should take this medication, the benefit for the mother should outweigh this severe adverse effects that it would have on the fetus. It is unknown if Zontivity and its metabolites are excreted in human breast milk. However, it is in rats, and due to the potential serious adverse effects on the infant, the mother should either choose to discontinue breastfeeding or discontinue Zontivity while breastfeeding. Caution should be taken in patients with renal impairment, but no dose adjustment is needed. Also, no dose adjustment is needed in patients with mild to moderate hepatic impairment. However, based on the increased risk of bleeding in patients with severe hepatic impairment, Zontivity should not be taken. This medication does interact with other medications such as CYP3A inhibitors, such as clarithromycin or ritonavir, which increase the effectiveness of Zontivity. Medications such as CYP3A inducers, such as St. John's worts or Dilantin, should be avoided because they decrease the effects of Zontivity. Adverse effects include fatal bleeding, intracranial hemorrhage, and hemodynamic compromise where intervention is needed, such as blood transfusions. Other reactions include increased bruising, anemia, a rash, iron deficiency, and retinopathy. A patient should report any severe bleeding, or if they notice blood in their stool or urine, they should notify their primary physician or go to the nearest ER. This medication is supplied in 2.08 milligrams. It is a yellow film-coated tablet that is prescribed in 30, 90, or 100 tablets. This medication can be kept at room temperature and should be kept with a seal-tight lid, child-proof lid, and kept out of the reach of children. Thank you for your time. I hope this information has been helpful. Thank you.